Hey everybody, thanks for tuning in again to Simply the Zest. Again, our new series, we're connecting with some of our networking partners to get a sense of what they do and how they can best support our families and our children in our community. Super excited. We have our office guest here, Dr. Ashley Poklar, just to talk a little bit about what she does and just get a sense for our families of where they can find out some information about her. So first, thanks so much for joining us, Dr. Poklar. We really appreciate it. Tell our patients and our families where they can find out information about you and your services.
Great. Thank you for having me. My name is Ashley Poklar. I go by Dr. P usually with my clients, and you can find information from me by searching my name, Poklar, at Psychology Today or at that's my email address, or at apoklarponders.org.
Cool. You have such a wide breadth of services, and like when we were first talking about some of the things that you do, it is incredible. First of all, that you find time to do all these things. So there's so many things we could jump into. I think a huge one for us, in the pediatric space is parents' concern about, am I doing a good enough job for my child? Am I setting them up for success? How do you typically approach families when they come to you with these concerns, or what does that conversation look like?
So I usually start that conversation with a quote from Donald Winnicott back in the 1950s, and it still holds true today. And that is that good enough parenting is good enough. Yep. And the research supports that even if you're being the best of the best, the outcomes are the same as being just good enough. Actually, in some ways, it's worse to be the best of the best, sure. Especially in today's world, where when you look up how to parent at any age, you're given completely contradictory information online, and pretty much no matter what you do, it's still wrong in some of these eyes. And the reality is, your children will help tell you how to parent them. Each child has their own way of being and their own way of responding to things. And as long as you're trying to be in tune with that child and doing what you can for that child, good enough is good enough.
Yeah. And I think, you touched on a super important point that we've talked about in some of our other episodes. There's so much information online, it is overwhelming. The internet is so polarizing for families, and when they get online, they see on Instagram and Facebook, what their friends are doing, how their child's reacting. It is so hard not to get sucked into that, oh my gosh, my kid is behaving this way. Like, is there something wrong with me? Is there something wrong with my child? Have you seen, I suspect you have, the change over time with parents' concern given the media kind of access that they have now?
Yes. So a lot of times that first session with families is really a consultation. I'm not even assuming that we're going to continue therapy or that we're going to need testing until I had that first session. Sure. Because a lot of times families come in because somebody told them they were doing it wrong, or they thought that their child's reaction to something like taking a teenager's cell phone away for good reasons led to too big of a reaction. But when you look at the developmental stage of that child, a teenager throwing a fit because their phone was taken makes sense because to the teen, their brain, the way it works, taking away their phone, limiting their social connectivity has the same impact on their brain as physical pain does.
Oh, wow. That makes sense, I guess, for some of the teens, but that's incredible. Thinking about some of these younger kids, these temper tantrums, hitting, biting, things like that. What would you say, I'm sure it's a huge explanation, but kind of a simple approach for families, that first step, how should they respond and react to those situations?
Yeah, so the kicking and the biting with toddlers, first step for really any interaction with your child when they're doing behaviors that you think they shouldn't be doing is check yourself. So for parents, the first step is emotional regulation. If I'm angry, I need to step out and take a few minutes because responding angrily is not going to lead to anything positive. Right. So step one is checking self. Step two is really removing the child from that situation in a safe way. I find if they're fighting over a toy, put the toy on timeout. The fighting stops, but nobody's having a temper tantrum about the correction and being embarrassed. Sure. And then really looking at those behaviors through that developmental lens. Toddlers kick and bite. It's how they express themselves because they don't have the words yet. Yeah. And so if it's developmentally normal, then it's giving those the words, helping them to become more developmentally appropriate in how they express themselves. But if it's, a 12-year-old that's kicking and biting to get their needs met or their needs heard, then you're looking more at coming to see me and working on some more in-depth interventions.
Yeah, a little bit of a different story, again, depending on the developmental age of that child. Thinking through some of these kind of behavioral outbursts, again, it varies based on the age of child, developmental level of the child. Thinking through some of the teenager concerns, getting into high school, I see it's a huge black box to open up. Parents concerned about their teens, maybe pulling away. How much of that can be normal? And again, kind of give us a range of that, and how should they start approaching those situations?
Yeah, so part of teenage development is to decide who they are apart from their parents. So it's very normal for them to pull away. It's very normal for your child who used to agree with everything you said to now disagree vehemently to everything that you say. It becomes scary or problematic when the child's unwilling to engage with the family at all. So they go into their room, they lock their door, they don't come out, nothing feels motivating. So you're seeing those signs of depression or anxiety really creeping through. Again, to some level, that's normal, but when it's impacting their daily life, it's concerning. When they're no longer interested in anything they used to be interested in, that's problematic. If they're on their phones all night or their iPads, very problematic. As a parent, the best way to manage the teenage years, and you'll hear me say this for a lot of things, is to have those conversations early and often. So engage in family togethering activities, engage in limits to screen time, limits to phone time when they're younger, so that's just how you do life as teenagers, instead of trying to put those limits in place later.
Yeah, I think that applies for so many things across kind of pediatrics in general, right? Those picky eaters early on, expose them as much as you can early on, right? We establish these great habits early on. It's easier. It's harder to break those habits once they've established. It's much easier just to kind of be preventative with that.
And it feels like an attack on their personhood when you do it later. Whereas if it was just, we always have dinner as a family, that counts when you're 16 too, versus all of a sudden now you have to eat with us. It feels like a punishment at that point.
Definitely. Again, kind of talking with the teenager in the media use, are you able to provide some kind of general safe, media practices, talking with our teens, thinking about the Snapchats, the Instagram, the TikToks, having them realize like, hey, this stuff stays out there for a long time when you're applying for a job later on. What's your general kind of recommendations for families in regards to some of the social media stuff?
Yeah, so having, like I said, those conversations as soon as they're given a phone. You're getting this phone. It is a privilege that you're getting. It's not a right that you have. And if you use it inappropriately, it's taken away. So set that boundary from the beginning, and set the boundary of, I will be checking it randomly and whenever I want to, and you will not change the password. If you do, you lose that right. And so you set the expectation that mom, dad, grandma, whoever the caregiver is going to check in regularly, and they're going to read what you're writing, and they need all of your passcodes for all of your apps and that kind of thing. I personally don't give my own children smartphones. I don't recommend smartphones for children under the age of, right now they're recommending 16, I would say, when they're going to college, but their brains aren't in a place where they can really make those decisions. You mentioned the photos and they'll be there forever. A teenager's not able to think in that forward-thinking way. Their brain just is not capable of it, especially the younger teenagers. So when you say, this photo will be there when you apply for jobs, a 13-year-old thinks, oh, when you apply for a job, you're so old. It'll be different then, or it doesn't matter. And so they just can't think in that way. So you set these conversations up early. I'm a big fan of talking with them about the potential dangers. So a lot of parents try to protect their child from the scary things. But then when their child inevitably faces the scary things, they don't know what to do because they didn't have the conversation. And actually, research shows that the majority of children are exposed to porn by the age of 12.
Wow.
So how many parents are talking to their children about that before the age of 12? Very few. And so these kids are looking at it and don't know what they're looking at.
And I think for a lot of our families too, I've said this many times before, they're going to get so many attempts to try some of these parenting things, to try some of these engagement activities. If you get it wrong the first time, like, give yourself some grace, right? Like, they're going to present you with another opportunity to practice those skills. And it is a skill, right? We don't get it right all the time. I think it's so important, as I'm sure, you'll talk about, letting your kids know, I'm not perfect, right? I make mistakes. Here's how I wanted to do things. This is why I'm sorry that we didn't do it that way. How much benefit do you see with them just, normalizing that it's okay to make mistakes?
So much.
Yeah.
The number of, again, I work with a lot of teenagers, the number of teens that I see that don't go to their parents about sticky situations that they get into. And they tell me, well, my mom acts like she's perfect, or she thinks she's perfect, so I can't tell her that I did this. And then when I bring mom in, mom's like, I made those same mistakes. And I just want to be like, just tell them. But we as a society create this belief that if our kids knew that we made mistakes, then they wouldn't look up to us or listen to us. Sure. But in reality, if we validate how they're feeling and own up to where we mess up, it leads to them being willing to be more vulnerable with us.
Yeah, that's great. I feel like we could sit here probably for hours and discuss all of the issues with teenage in just one thing. But in the interest of time, I wanted to thank you so much for sitting down with us today, Dr. Poklar, Dr. P. I'm also Dr. P, so it's a little tricky. But
it's kind of weird.
Well, it's all right. We can coexist in the office space. Please tell just kind of some of the breadth of the services that you offer for our families, and then kind of give us a quick recap of where they can find out information about you.
The services I provide are pretty vast. Basically anything that you think of in the world of child and adolescent psychology, I can either cover or at least do a consultation and connect people with the appropriate services. Yeah. I do child and adolescent individual therapy. With the acknowledgement that I don't just see the child or adolescent. I'm not the drop them off and let them stay with me for an hour. I will want to talk to the parents as well. I'm willing to do family therapy also. And then I also do assessments. I can do wide-ranging assessments. So everything from learning disabilities or intellectual disabilities to assessments that include behavioral concerns or personality concerns for ages 3 to 17 years, 11 months.
Okay.
And I do a lot of crisis management. Yeah. So if a child is experiencing suicidal ideation or self-harming, or there was some sort of a disaster that's impacting their family or themselves, or just out of nowhere their behavior or mood really changes significantly, I can do that liaison kind of space of let's get you settled, let's get you set, and get you connected with all the places you need to be, and be that emergency contact for a family for that short time of triaging that emergency.
Sure. And I can only imagine your amount of clients has probably just skyrocketed with COVID. And
COVID was
which is terrible. I mentioned we share an office space, but there's an exciting development now. You have been signed on officially as one of our ZAPs. Yes. We were so excited to be able to bring you on. Dr. Poklar is such a fantastic resource for our families. Tell us a little bit about some of the services you offer through the ZAPs program.
Yeah, so through the ZAPs, as part of patients' enrollment with you all, they can get that crisis service that we had discussed. So if a crisis happens, I'm an added resource to help them navigate some of those psychiatric crises, and also a free consultation to families. So if you're unsure of if your child needs some support, or is this developmentally appropriate or not, or how do I set these boundaries around this phone? So I can do that a one time per year per patient, and then ongoing services as needed at a reduced fee.
Yeah. I just can't even express it, how excited we were to be able to bring you in again, just to be able to think through this more holistic childcare, this whole childcare that we're trying to provide with Zest. Once again, Dr. P, Dr. Poklar here. Thanks so much for sitting down with us today. Really appreciate your time. Thanks for tuning in, and until next time, we'll see you around. Bye.